Hi everyone, this is a complementary video to the brain blood vessels #1 video included in the neuroanatomy lessons of my website and in the neuroanatomy of the dog book 2nd edition. As other authors have pointed out that the blood flow in the basilar artery of the cat is rossocaudal compared with the dog where is caudal-rostral. I was commenting in the previous video that this situation may be the cause of more rostral cerebellar infarcts in dogs compared to the cat, due to possible turbulences created by the blood from the caudal communicating arteries meeting the basilar artery. This situation seems to be not true. After studying corrosion cast of dogs and cats and looking for the size of the basilar artery. Here you have a caudal vision of the cranium of a dog and with the arteries. This is a corrosion cast and you can see the basilar artery there. In the cat, what do you see is the basilar artery as well through the foramen magnum. This is the atlas. Okay? And as you see, there is a big vertebral artery that is meeting the basilar artery, and caudally the ventral spinal artery is very thin. So this means that the blood flow should be caudal-rostral, no rostrocaudal, as in the dog. When we wide open the mouth of a dog, what do we have caudal to the mandible? We have the maxillary artery, and this maxillary artery in these situations may be trapped. In the case of a cat, when we wide open the mouth, so the mandible traps the maxillary artery, as it may happen in the dog. However, in the cat, remember that the maxillary artery gives rise to the rete mirabile, and arteries from the rete mirabile enter the cranial cavity, giving rise to the internal carotid artery. So, in these cases, wide open the mouth in a cat may occlude the maxillary artery, and in the cat the maxillary artery is very important for the formation of the internal carotid artery. So, in cat, maybe the blood flow to the encephalon may diminish in these situations. Also, we have to include some aspects of the middle and inner ear vessels. Here you see in a dog, this is a corrosion cast. So there is a rostral tympanic artery here and here. This is a very small branch of the maxillary artery that enters one of the small foramina located in a depression medial to the joint. There is also another artery. There is the caudal or posterior tympanic artery. As you see here, you see the caudal auricular artery branches off this caudal tympanic artery that enters the stylomastoid foramen and forms what is called the stylomastoid artery. And as you see, as it gets inside, it's going to vascularize the middle ear. Regarding the arterial supply to the inner ear, we have several arteries, at least in a dog. First, this is a inside view of the cranium, is a corrosion cast. The cranium has been cut through the middle plane. So you see the dorsum sella here, the petrosal portion of the temporal bone, and the basilar artery. So first we have E, the letter E. This is an artery that is going to enter the internal acoustic meatus, and is an artery that has branched off from the rostral cerebellar artery. This is the rostral cerebellar artery. As you see in this image, the rostral cerebellar branches off a small artery that enters the internal acoustic meatus. Another one is an artery branching from the labyrinthine artery. This artery, as it also vascularizes the cerebellum, should be named middle cerebellar artery. And as you see, this is a small artery that enters the internal acoustic meatus. And finally, is an indirect pathway. So we have letter C. Is an anastomosis from the caudal cerebellar artery that joins the labyrinthine artery, or may be named, in this case, this portion also may be named middle cerebellar artery. So in the case of a cat, again, you see a midplane section of a corrosion cast, and we have enlarged this area. So what do we have? We have that the basilar artery branches off a common branch that is going to give rise to the caudal cerebellar artery, and what we can name middle cerebellar artery because it also sends some small branches to the cerebellum. And this small branch here is the labyrinthine artery. This is the rostral cerebellar artery, as in this case there is not an anastomosis between this labyrinthine or middle cerebellar artery with the rostral cerebellar artery. As you see here, with the forceps, we can move this artery here, okay, from the rostral cerebellar artery. Let's go and have a look at some dissections. Okay, this is from the left side of an encephalon, rostral and caudal. What do we have here? We have the basilar artery, the caudal cerebellar artery, and bit caudally we have a medullary artery for the medulla oblongata. As you see here, this labyrinthine artery has a double origin. Remember, there is a great variety of the arteries at this level in the encephalon. And from this one, as you see, there is an artery going through the choroid plexus, and this is going to enter the internal acoustic meatus. On the other side of the same encephalon, you see the labyrinthine artery, okay, that vascularizes the internal, enters the internal acoustic meatus to vascularize the inner ear, and also sends branches to vascularize the facial and vestibulocochlear nerves. And this artery is sending an artery to the choroid plexus. And then we have here the caudal cerebellar artery that sends branches to the choroid plexus as well of the fourth ventricle. This is an enlargement of this area where you can see the labyrinthine artery and a branch to the choroid plexus of the fourth ventricle, in particular to this choroid plexus that has been that is located outside of the fourth ventricle. Okay, this is an expansion out of the fourth ventricle to the lateral foramina of the fourth ventricle. Okay, so what do we have here? We have the caudal cerebellar artery with some branches to the choroid plexus. This is another case. In this case, this is interesting because we have here, we have the caudal cerebellar artery, and then we have this artery that it's named usually the labyrinthine artery, but in this case seems to be double, okay? Seems to be double. There are two of them, and one of them is going to vascularize the choroid plexus of the fourth ventricle. And also this artery seems to be connected, seems to be branching off instead of branching off from the basilar artery, branches off from the caudal cerebellar artery. If we compare these arteries between human, dog, and cat, what do we see? First, human. In the human, the superior cerebellar artery, it should be letter B, and then we have an anterior inferior cerebellar artery, anterior inferior, from which one detaches the labyrinthine artery. And finally, the posterior inferior cerebellar artery branches off from the vertebral artery. If we move, these are cerebellar arteries. If we move to the dog, what do we see? We see the rostral cerebellar artery branching off from the caudal communicating artery, and then we have the caudal cerebellar artery and the labyrinthine artery. However, as you see the great variations, we can have another cerebellar artery that is smaller than the rostral and the caudal, that is vascularizing the choroid plexus and part of the cerebellum. And if we move to the cat, what do we see? We see the rostral cerebellar artery, letter B, and in this case, branching off from the basilar artery, we have a common branch that divides in the caudal cerebella and the labyrinthine artery. The labyrinthine artery here. However, as you see, this small labyrinthine artery seems to detach from an artery that vascularizes also the cerebellum, that we could name it middle cerebellar artery. Remember that the nomina anatomica veterinaria does not recognize the middle cerebellar artery. However, Getty, in the Anatomy of the Domestic Animals in Caesar and Grossman, yes, it pointed out this middle cerebellar artery. So, vascularization of the middle ear and the inner ear. The middle ear, the vascularization comes from the maxillary artery and from the caudal auricular artery. The maxillary artery, as we have seen in the images, gives rise to the rostral or anterior tympanic artery that is constant in cats and inconstant in dogs. And the caudal auricular artery gives off the stylomastoid artery that enters the stylomastoid foramen together with the facial nerve. And this one gives rise to the caudal or inferior tympanic artery. The inner ear is vascularized mainly from the basilar artery through the labyrinthine artery, that divides in a cochlear and a vestibular artery. In relation to the veins, the cochlear veins do not follow the same route as the arteries. Thank you very much.